medical condition. So anxiety is not a kind of small thing. It's something that can come up in many different situations across different experiences and impact people in various ways that interfere with daily life. So some common traits, those were all nuanced, different anxiety disorders, but some common underlying traits are that the person will experience excessive worry, there's a sense of impending doom or panic, sleep disturbance, that perhaps you're up for a long time, ruminating and thinking about the things that are creating anxiety, or that you're oversleeping to try to shut your brain off, difficulty concentrating. If you're feeling very anxious, it's very hard to process information and retain information. So there's a lot of memory issues. Restlessness, irritability. Some common body sensations that go with anxiety is that you'll feel like really tense in your muscles. You might experience headaches, sweating, increased heart rate, stomach issues, shakiness, lots of different body sensations that can be very unpleasant. And avoidance is a very common trait of anxiety because it is a really, most people don't want to feel this way. So it makes a lot of sense that you would do things to avoid situations that bring up that anxiety. So statistics-wise, this is a very common thing. Estimated 31.1% of adults in the United States experience an anxiety disorder at some point in their lives. So that's a pretty big number. Females are more typically going to be diagnosed with an anxiety disorder. Among adults with an anxiety disorder, an estimated 22.8% experienced really serious impairment, and 33.7% had moderate impairment. So it's definitely something that interferes with the day-to-day life and can have a lot of consequences that go with it. A majority of people experienced at least some form of impairment. So 43.5% had at least mild issues that came with this. And adolescents, 31.9% have experienced an anxiety disorder. And this really was representative across different age spans in adolescence. So it wasn't like one particular one. Anxiety comes up at different stages of life in adolescence as well. So what can happen and what makes this so difficult and leads people to seek treatment or hope that something can give them relief is that there are a lot of life interfering results that go with experiencing anxiety over a long period of time. What happens is that you're not able to meet responsibilities. That might be with your job, that you're not able to follow through on things because anxiety, whether it be related to the job or not, it's getting in the way of being able to be present. You'll remember just a couple slides ago, one of the things that happens when you feel very anxious is that you have a difficulty processing information, retaining information. So that can get in the way of a job, of course. It can interfere in the family. It just really makes it difficult to follow through with things that you need to do when you feel very preoccupied or maybe exhausted from feeling so anxious about something. It can impact relationships. So even again, if your anxiety isn't related to relationships, it can definitely get in the way because if you feel very anxious, it's hard to concentrate on and be mindful in an interaction with somebody else. So you might feel irritable, that your attention is getting kind of pulled in different directions. You may find that you're avoidant or not really going towards social interactions, which can certainly impact relationships. You might avoid them or isolate. Or some people that experience difficulties in relationships with anxiety might seek reassurance, which can certainly chip away at relationships. If you're really anxious that something you've said or done has impacted somebody negatively and that tape keeps playing, like, oh my gosh, what are they going to think? Are they mad at me? And if you go and ask them over again, like, hey, are you mad at me? Over time, that chips away at a relationship to continuously seek reassurance. It can also lead to ineffective coping techniques because if you don't know what to do with it, you're going to do the best you can to try to manage the anxiety coming up. So this also leads to other disorders like substance abuse. You might engage in disordered eating habits. If you're feeling very anxious, sometimes people will emotionally eat to cope and it could turn into binge eating disorder, for example. Another ineffective coping technique might be to try to control and manage any situation in which anxiety could come up. And that can impact, your life just in the other areas we were talking about, like with your job or relationships. You may find over medicating is a way that you try to cope by not taking meds as prescribed, and that also is that's not effective, and that's not going to give you a quality of life that most people would want. It might give you temporary relief. It's probably going to have a lot of consequences that go with it. And another life interfering result of anxiety is that there's a change in physical health. So you might notice that you're struggling with chronic pain now. Research has shown that a lot of somatic issues that come from anxiety are there because, the mind-body connection, that you have GI issues, so difficulty with your stomach, your weight might change, feeling fatigued, all of that. So there's definitely a connection there. There's a change in physical health that often happens when there's chronic anxiety. Anxiety is pretty hard on the body, so there's definitely results there. Sleep issues, as we've stated before, one thing that we definitely want to mention is that if you feel very anxious often and it interferes in your life, then you may become depressed. And depression and anxiety are often comorbid, which means they happen at the same time. So it's kind of like the chicken and the egg situation where, which one came first. When we're talking about anxiety and anxiety disorders, we're going to think of it in the way that the anxiety came first, and just for tonight's talk. And if I'm having trouble meeting my responsibilities, if I feel like I'm messing up relationships because I can't manage my anxiety and I feel so overwhelmed, then I'm probably also going to start to feel depressed over time. And in situations where it feels very overwhelming and it's so uncomfortable and so intolerable, or you feel like anything you do just kind of makes things worse, individuals sometimes will experience suicidal ideation, where it feels like, I don't know what to do with all of this. This is so overwhelming. The only way out feels like through hurting myself, through suicide or self-harm. So that can definitely also be a life-interfering result. So the good news is that there are a lot of options to treat anxiety. Anxiety's been around for a long time, so there have been a lot of opportunities for us to kind of figure out things that can help to manage that. So one option is through medication management. Something to note is that most medications that are going to be helpful with mood disorders are going to take 2 to 4 weeks to help kind of level out. So if you start taking them, it's going to take some time for your body to adjust to it. Now I'm not speaking about like faster acting medication that are more situational, like a benzodiazepine medication. I'm talking about something that's going to really stabilize your mood. So mood stabilizers, those are going to take a longer time to work. Another treatment option is going to be psychotherapy. So that's what we're going to focus on tonight, the different therapeutic approaches that can be helpful, that have been shown through research to be helpful, or some component of them to be helpful with anxiety disorders. Another important thing is to consider lifestyle changes, that sometimes the things that we're doing in our day-to-day life are actually contributing to how we feel. And so sometimes it helps and sometimes it doesn't help, and it can make things worse. So it might be helpful to change up your routine. That means maybe having a more stable bed routine, close, to go to bed at an earlier time, to get up at the same time, to really try to keep a regular routine there. You might want to work on exercising, and that doesn't mean like getting a gym membership and really going like every day and running multiple miles and doing all of these things. It's really doing about 20 minutes a day of something that elevates your heart. That's been shown to help with mood disorders, including anxiety. Changing the foods that you eat. So food can also really impact how you feel. So if you're eating things that are making you feel like groggy, sugar can definitely impact anxiety. If you're drinking a lot of coffee or caffeinated beverages, that can certainly contribute to anxiety as well. So really paying attention to, what am I doing in my day-to-day life and my routines that might be contributing to me having a little bit of trouble here or a lot of trouble with anxiety. And often it's a combination of all of these that's going to be the most effective. So you're going to want to kind of weave all of these together to find the most relief and the longest standing relief. Hold on just a second. Okay. So what I want to do tonight to really kind of help paint a picture is I'm going to go through some different therapeutic approaches, and I'm going to give examples through our friend Jane here. So Jane struggles with anxiety, and she recently actually lost her job due to not being able to complete work projects and avoiding anything where she'd have to interface with people. So that's a problem because most of us have to have a job to be able to make ends meet and to support maybe others in our family financially. So she has a degree and she has expertise in a field where she has to interact with people. So we're going to have to do a little bit of problem solving to work on this because anxiety has really gotten in the way for her. So we're going to use Jane as our frame from which we're going to work, so you guys can see the different therapeutic approaches and a little bit of how it might look for Jane in this situation, applying it to her anxiety. So you might better understand for you or your loved ones or whomever you're watching this tonight to kind of learn more which one might be the best fit. So the therapeutic approaches to anxiety disorders are really meant to help retrain your brain. So we go about our lives every day in our routines, and we're really kind of ingraining in our brains these neural pathways. Our brains are really sophisticated, they're very efficient, and they help us to get from point A to point B as quickly as possible. So sometimes the way that we get from point A to point B has served us in the past. So it might be avoidance of a situation, like, oh, if somebody tells me that, they want to go meet up after work in a social situation, I'm not going to do that. I'm going to avoid it because I don't want to feel additional anxiety already more than I feel during the day. So your brain has created this neural pathway to have that be the option and the answer for any time that pops up. So we can do things to retrain our brains to create new neural pathways, and these different therapies can help with that. So the one that's been shown to be the most effective are exposure therapies. And we'll go through a little bit of the components of that. Research has also shown that CBT, cognitive behavioral therapy, is very effective in treating anxiety disorders. And then acceptance and commitment therapy is also effective in treating anxiety disorders. And you'll notice that I bunny hopped over dialectical behavior therapy because that approach as a whole is not actually shown to be as effective. It's shown to be effective if you break it down into the components. So it still can be very effective in managing anxiety. Many people that come to Clearview struggle with an anxiety disorder that they have in addition to other disorders that they're working on while here. And the skills that you learn within DBT can be very, very helpful in managing that. So we'll start with the one that evidence shows to be the most efficacious, and that's exposure therapies. So exposure really aims to help the person that's struggling with anxiety get more of a sense of control in whatever it is that's anxiety provoking for them. And it also helps to desensitize them to the thing that they're really afraid of. So desensitizing just means that they're turning down the volume on the thing that creates the fear for them. And this is done through structured exposures to what they're afraid of. And different types of exposure therapies include prolonged exposure therapy. That's typically used for trauma, and we do that therapy here for our clients who, when appropriate and when they're ready to do that really tough exposure work, prolonged exposure can be very helpful in processing traumas. Systematic desensitization is one that we'll talk about a little bit more in a second, and that's another exposure therapy. Exposure and response prevention, graded exposure, and flooding. So in exposure therapies, the first thing that you're really going to do is you're not going to jump right into the thing that you are afraid of. If you're afraid of flying, for example, you're not going to, as soon as you start working with an exposure therapist, get on a plane and fly to Key West. You're not going to do that because that's not helpful. That's way too intense, too quickly, and you're not prepared. So what you're going to start with is really getting a foundation through relaxation training. So you're going to start with your therapist learning and practicing whatever relaxation technique works for you, so you can engage in exposure, and then when it gets to be too intense or it gets to be a certain point of intensity that you've agreed upon with your therapist, you'll stop the exposure and you'll switch to relaxation to help calm your body. So some examples of this might be progressive muscle relaxation or paced breathing. And after you figure out what works for you as far as relaxation training, you're going to create a step-by-step of items that, as you kind of level up, increase in distress, with the most distressing thing being your final goal. So again, if your goal is to be able to fly, let's say you have to fly for business, then you're going to start with something like looking at a picture of an airplane might be step one, or even just talking about it. And then once you've desensitized enough that you can look at the picture or talk about flying and not experience really, really intense anxiety, then you'll move on to the next level, which might be watching a YouTube video of somebody flying a plane. And you want these steps to be specific and measurable. So as you work through them, you're going to track how distressed that you feel. Again, when you reach a certain level of distress, you're gonna stop, you're gonna go to your relaxation technique and really try to bring yourself back down. And then you're going to consistently keep doing the exposure, switching to relaxation when you need to, until that volume's turned down on that specific step, and you can increase and go to the next level of distress. So the example, our friend Jane that we're going to be referencing tonight, she's searching for a job and preparing for an interview. And the idea of this brings up a lot of distress for her. She had a pretty upsetting termination to her job. This was a job she really cared about. She was really great in her field. She still is. But having that social anxiety really got in her way. So as she's searching for a job, if she's working with an exposure therapist, then her hierarchy or her distress scale might start with looking at job postings online and not even looking at them and preparing to apply. She might just be looking at a couple ads that are on like Indeed.com or something that her therapist prints out, and they look at the job descriptions, and she'll rate how intensely she feels anxiety. And if it's to the point they've agreed upon as far as distress level, then she's going to stop and she's going to do some paced breathing. And she's going to do that until her anxiety goes down. And then she'll go back to looking at these job postings with her therapist. And she might do the same thing as she prepares for an interview, that she might see, her therapist might start by showing her a picture of two people in what looks like an interview, and then do that exposure until she's ready to do the next thing, which might be looking at interview questions, just looking at them. And then the next step, after she uses relaxation and is desensitized, so the anxiety is turned down, it's not quite as intense, and then she might actually have her therapist ask her one of the questions. And she doesn't have to answer, maybe she's just thinking about it, but you can see that she's slowly moving toward the end goal and trying to manage and decrease her anxiety throughout. So the next therapeutic approach that can be very helpful with anxiety. Now remember, DBT as a whole is evidence-based and is very efficacious for a lot of disorders. Anxiety is one that when you break it apart and use different aspects of DBT, it's very effective, but as a whole, it's not shown to be as effective as like exposure therapy, for example. So with DBT, Dialectical Behavior Therapy, what this approach is doing is it's really trying to work on accepting the present moment, including the feelings of fear. So instead of pushing back against it, it's really trying to acknowledge that I'm feeling anxious right now and I don't need to judge it. I just am trying to notice that I'm feeling this way. And then it also balances. So dialectics are a balance of two seeming opposing things that can both be true at the same time. We want to weave into it behavioral change. So we want to notice and acknowledge, accept that we're feeling anxious, and also do things, behaviors that help us to change the way we're responding to anxiety in a way that's not going to increase it. It will hopefully reduce it and improve our quality of life. So there are very specific skills that target symptoms of anxiety and can help to reduce the intensity and just your overall relationship with the emotion. So we want to and are constantly striving for that balance of acceptance and change, which is dialectics, and that's the essence of DBT. So research shows efficacy, again, of using DBT skills, so specific skills with anxiety disorders. And so some of the components of DBT that help us, especially when we're feeling really stuck, maybe feeling burnt out with the anxiety, and if we're really working to change and things don't seem like they're really shifting or not as quickly as we would like, dialectics within dialectical behavior therapy can be really helpful to come back to, where you can acknowledge both things and really know that you first have to accept that this is something that you struggle with before you can work on changing it. Because if we don't accept something, then we can't really accept something, we can't really change something that we don't accept. So one thing that can help to reduce burnout when things aren't shifting in the way that you'd like, or let's say that this is a loved one who struggles with anxiety and you're having a really hard time seeing what they're going through and knowing that they're maybe not open to reaching out for support, or they're having a hard time with the changes that they need to make and the work that they're doing. So there are things called DBT assumptions that can really help in those moments to reduce burnout, increase empathy, and help us keep that non-judgmental stance. And some of those assumptions are saying, there are several of them, and one of them is people are doing the best they can with what they have in this moment. And the other side of that dialectic is, and they need to be more motivated for change and try harder. So it's definitely, it's meeting the person where they're at and holding both to be true. And DBT is very structured, which can be very helpful. It's going to almost be formulaic in some ways, where if this is going on for this person, if they're struggling with this target behavior related to their highest target, which with anxiety, if they're struggling with suicidality around anxiety or self-harm behaviors, then it's very structured. There's a treatment hierarchy where we're going to address that first before we address anything else in therapy. And there will be interventions that are specific to that I'll go into. So there are 4 modules in DBT. Mindfulness is a core skill module. So this is the foundation of all the other skills that helps us to be aware of the present moment and accept it, pay attention on purpose without judgment. And we use very specific skills to do that. And that can be really helpful with anxiety, even though when we're feeling anxious, the last thing we want to do is be in touch with that. And it's really important to be able to mindfully observe without judgment, anxiety or fear, so we know what to do with it and we know what skills might be helpful. So something else that's important with mindfulness is that if you're paying attention to how you're feeling without judgment and really trying to connect to that, then it's going to allow for more accurate communication to those around you, whatever your needs are, or just how you're feeling in general. So the example here with Jane, that if she's feeling particularly anxious and she's in an interaction with others, that she may stop and notice, oh, my heart's racing right now, or I'm starting to sweat. And this is an internal kind of thing that she's noticing. And she might share with whomever she's with, let's say it's a good friend, that she says, oh, you know, I'm starting to notice that I'm having a hard time right now, and I think that I need to go home, or why don't we have this meetup be at this place, because I'm noticing that right now I'm having a hard time concentrating because of what I'm feeling in my body. So you can word it however you want, or whatever's comfortable with you and the person that you're interacting with. But mindfulness helps for you to connect to that, and it helps for you to be able to accurately communicate it so the other person really understands, versus having their own interpretation of what you're trying to say. So another module from DBT is distress tolerance. So this is also an acceptance-based skill. Mindfulness is acceptance-based as well. And this helps us to tolerate distress when we can't change it in the present moment. This is not something you want to do to solve everything in your life, because that's not going to help you get a life worth living. It is something, though, that can help you get through a moment without it getting worse. So this is really helpful with anxiety. Anxiety is super activating, and it produces a lot of energy that you want to get out, or that as you feel it, you start to feel even more panicked. So these skills can help you accept that you're feeling this way, and then also ground from that distress. So there are many acronyms for different skills within this module. There's TIP, which is an acronym to help ground through changing your body chemistry, like using intense temperature, like putting your face in ice water to help slow your body down and kind of turn on the emergency brake. There's the acronym IMPROVE, which is to help improve a moment when it's not ideal. And that's through doing things like using imagery. So you might imagine being at a place that you've found very peaceful. If you've had a place like that in your life, like maybe laying on the beach somewhere, or if you've been on a very nice hike, noticing, really trying to put yourself back in that place. Again, using those mindfulness skills from the previous slide, where you might notice anything you could imagine with your 5 senses. Another skill set is reality acceptance skills. So it's being able to say, man, I don't like how I'm feeling right now, and that's how I'm feeling right now. So reality doesn't change because we don't like it. It's something that when we push back against it and say, like, I don't want to feel this anxious right now, that doesn't change that that's how anxious you feel. And now you're probably actually feeling a little worse because you're pushing back against reality. So reality acceptance skills in the distress tolerance module can be very helpful in reducing that added layer called suffering on top of regular emotional pain. You can also do a pros and cons, which is looking at, okay, if I avoid this social situation, it may give me some relief temporarily from my anxiety. It also might really impact my relationship with this person. So you can kind of balance those out to help you make a more informed decision, not just based on how you feel. And self-soothe is certainly important and helpful in this module. Anxiety is draining, anxiety is intense, it can be. So it's helpful to use some self-soothe to relax a bit and take care of yourself. So the example here, Jane applying for jobs, as she's job hunting, she may feel anxious and more anxious. And if she gets to the point where she submits an application, she might feel very, very distressed. So something that she could do to help ground from this distress would be to do some self-soothe. So she might run a hot bath, have some scented candles around the bath, really try to mindfully notice how warm or hot the water is, the scent of the candle. If she's feeling extremely distressed, she might do some intense exercise. That's the I in the acronym TIP. And that can help get some of that energy out, because anxiety really is very activating and that energy has to go somewhere. So that might be something that she does, that she applies for a couple jobs and then she goes for a run. and she tries to just let that energy get out in a way that's effective. Another module in DBT is emotion regulation. So the goal of this is to really help us reduce emotional suffering through better understanding anxiety when it's coming up, any emotion, but tonight we're talking about fear and anxiety. Putting a name to it, doing things to help reduce vulnerability to the emotions that are painful, and really when you notice anxiety coming up, trying to do something to change it. So these are change-based skills. The goal is absolutely not to eliminate these emotions. We are not ever trying to eliminate an emotion, because emotions are very functional, just like we were saying on like the first slide, that they're adaptive. They help us survive. They serve a purpose. Anxiety can motivate us to action. And it's something that's really important in our lives. However, it can get in the way. So the goal isn't to eliminate it. It's just to be able to better understand it and to regulate it. The impact of anxiety disorders can really actually increase negative emotions. This is where we might see depression come in. And so we get stuck in this cycle where we feel very anxious, and so we avoid something, or maybe we use substances to try to cope with it. And then after that wears off, we feel really depressed and low and negative about ourselves for things maybe we did while under the influence, or responsibilities we didn't follow through with. And so then we feel depressed, and then we miss out on other things, and then we feel anxious because we missed out. Maybe we didn't go to work the next day because we didn't feel well and we were depressed. So you can see that it gets us stuck in a cycle. So the skills from this module can help us to cope ahead. It can help us with that acronym PLEASE. It takes care of our body to take care of our mind. So doing things like making sure we're exercising, we're sleeping well, we're eating right, we're avoiding mood-altering substances, treating physical illness, things like that. Coping ahead if we know we have something coming up that's going to be difficult. Problem solving, using this skill called opposite action, which means that if you are feeling anxious, and every emotion has an action urge that's hardwired to it, but if you're feeling anxious and the action urge, the thing that you want to do, the thing that anxiety is trying to get you to do, is going to be ineffective, then you're going to want to do something different that's more effective, which would be called opposite action. That's the act of not doing what that emotion's trying to get you to do if it's ineffective. So maybe it means that if I want to isolate because I'm feeling very anxious, opposite action might be that I actually go out into the living room and I talk with my family, or not even talk with them. You don't even have to go that far. But opposite action would be, I'm not going to isolate. I'm going to maybe go into the living room, or maybe go into the adjacent room from my family. So the example here with Jane is that if she's preparing for an interview, she's probably feeling pretty anxious. There's a lot at stake. Interviews create a lot of anxiety because you typically only have a few minutes to kind of sell yourself as an asset to a company. You never really know for sure what kind of questions they might ask, so there can be some anxiety there around the uncertainty. So an example of using emotion regulation for Jane here when she prepares for an interview, she might do a cope ahead plan. She might think about, well, what are the tough things that could come up in this interview, and how might I try to navigate these the most effective way that I can. She may also use that acronym PLEASE by making sure that she's getting a good night's sleep before the interview, that she's having a good breakfast with foods that help her feel good in the morning before she goes. She's not having coffee because coffee is going to probably make her feel more anxious, or if she does, she's going to have decaffeinated coffee, things like that. And then the last module in DBT is interpersonal effectiveness. So this module helps you build, maintain, and repair relationships. And it also really helps to understand how to effectively ask for what you need or want from others while maintaining self-respect. These are also change-based skills. And one thing that we know, and that we talked about in earlier slides, is that anxiety can really impact relationships. Not even if you have social anxiety, it just can get in the way. So what happens also is that our self-respect can get impacted. And we want to really try to reduce and change these symptoms. So it's important to identify the goals that you have in interactions, knowing when and how to use this skill called validation, where you're acknowledging what you're hearing and seeing from another person. That's really important in maintaining relationships or building relationships. Challenging myths, so it's these beliefs that we have about if we should or what it means to ask for what we need or want. This module helps to challenge that, because that can get in the way too. That if I feel like if I have this myth that it doesn't matter how I feel, I should always do what other people want, that could get in the way of me maintaining my self-respect and me being able to have and maintain meaningful relationships, and also just my anxiety in general. So the example here is that if Jane, let's say in this example that Jane has a job, she got a job. Yay, Jane. So she now has a situation in which she needs to communicate some needs relating to her anxiety. So she may use some of these skills, such as saying with validation, I know that this project is extremely important and I'm so grateful that you asked for me to work on this. I see that you want this done by tomorrow, and I want to make sure that I do a good job, and I'm going to need more than just one day. And is that possible? And if it's not possible, can we talk about a different way of approaching this so that I can give you the quality of work that I'd like to give? So that's a way that she could practice within this module. And we're going to go over a couple other skills that help with that, to be able to communicate needs at work. So some tools and interventions in DBT that use, that are very structured, part of the structure, that help us to track things, to intervene when necessary, and work on some of these symptoms and consequences and traits related to anxiety. One of them is the diary card. So this is what helps DBT to be evidence-based. You use this to track target behaviors, which are behaviors that an individual wants to work on increasing or decreasing. It helps us to set a session agenda. So when a client comes into session, we'll chat for a second, check in, and then I'll ask for their diary card so I can take a look at it, see how things have been going since the last time I saw them. They've rated themselves on the different areas that they want to work on, and it helps me to see, so if they're struggling with self-harm or suicidal ideation, and they write on their diary card that it increased a little bit, let's say the night before, we're going to talk about that first in session before we talk about anything else. Like, for example, if they're trying not to isolate as much from anxiety and work on activating and interacting with friends more, we'll get to that at some point. First, we're going to talk about the increase in suicidality. It helps us to set that agenda. So some examples of targets within people who struggle with anxiety, what might be on their diary card is tracking rumination, avoidance, self-harm behaviors, reassurance seeking, isolation. There's a lot of negative self-talk that comes with anxiety. And that might be something that the person really wants to work on, to have more self-esteem, self-respect, and self-compassion. There's another intervention called the behavioral chain analysis and solution analysis. This is so helpful in increasing insight into how we got from point A to point Z in a situation where you would either like to do the same thing again. So we want to see, like, wow, how were you able to prepare for that interview and go to that interview and follow through with it, no matter how it went? Like, that was a huge feat. Let's look at how you were able to do that. Or if it's a behavior that we'd like to reduce, like the example down there, let's say Jane avoided an interview because in the last second she panicked and she thought, oh my gosh, there's no way I'm going to get this job. I'm probably the least qualified candidate. What's the point? Then we want to do a behavioral chain analysis to see like, okay, what were the vulnerabilities going on? What were the things, the thoughts, feelings, body sensations, urges? What were the events happening that led you step by step to avoiding this interview? And then what happened after that? What were the consequences? And then we look at, okay, if something similar comes up, because we can't change the past, so we don't want to say, well, you should have done this, Jane. We're saying, hey, Jane, in your next interview, because you're going to have another interview, let's look at what we want to try to do to address those things that came up that moved you away from going to that other interview. So that is a really helpful intervention in DBT that really helps us to get in there and get some insight, and then look at, in the future, let's look at some other options for responding to what came up. Another intervention is a cope ahead plan. So we talked about this a few minutes ago. This helps us to make some space, get on paper, some problem solving ideas and planning ahead for things that could bring up anxiety. If you know that something's coming up, like let's break this down. What could be the thoughts that come up that make it difficult to use skills? What could be the urges or behaviors that you'll want to engage in if that happens? What are some of the skills that you'd like to do if that comes up? It helps to reduce our vulnerability to those difficult situations. Dear Man is an acronym from the Interpersonal Effectiveness module, and so I modeled it a little bit, more of an informal one, when Jane was asking for an extension or problem solving around a project at work. So Dear Man is an intervention that really outlines, it's actually very structured, it's an acronym that's describe, express, assert, reinforce, do it mindfully, appear confident, and negotiate if needed. So it breaks it down in a really lovely way that is going to allow you to either ask something of somebody or refuse a request. And it does it in a way that's going to make it more likely that the person stays in the conversation with you. So those conversations can be really tough to have, and it can be easy for you to go off track or for the other person to kind of have their defenses go up. If Jane went up to her boss and said, look, I know you don't care that I struggle with anxiety, but I can't do this deadline that you're asking. If she went up to her boss and said it in that way, the boss is probably not going to even hear the next part where she's asking for help and asking for an extension. They're going to feel pretty defensive probably and be more stuck on information or the communication that Jane gave that she wasn't meaning for the person to get focused on. So this really helps to list things out in a way that's going to make it more likely the person stays in the conversation with you. So an example here is that if she's preparing for another interview, she might cope ahead just as she's done for the other ones. So really looking at what could be tough, how can she handle it? And also ask her friend for help by saying something like, hey, you know, tomorrow I have this interview and it brings up a lot of anxiety for me. I wondered if you would have like an hour today that you could sit down with me and go through some potential questions that they may ask and give me feedback. It would really mean a lot to me. And, you know, next time that you need something like this, I would be so willing to help. I really, really would appreciate it if you could help me with this. So that was an example of a really short and sweet Dear Man that the person could do with their friend. So that's just a snapshot of what skills may be helpful with anxiety using DBT. So cognitive behavioral therapy is a very, very widely used approach for treating anxiety. This is taking dialectical behavior therapy actually kind of evolved out of CBT. CBT is really change-based, so it's looking at, okay, how are we thinking about this situation? Because it's really the way we think about and react to a situation that cues anxiety, not so much the situation itself. So it's a very behavioral approach, and it's looking at those components to really dissect, like, what could we do different here to have a different relationship with what's bringing up anxiety? So a big component of that is that we're going to examine negative thought patterns. So you better understand, like, oh, that thought comes up for me a lot in that situation. And when I look at how it makes me feel, it has a pretty big impact on how I'm feeling. And if I'm able to then identify a reframe or a thought that's a little more flexible, a little more helpful, then I might also change how I feel. Because the way that we think about something impacts the way that we feel about something. So some interventions and tools in CBT are thought records. So this is super helpful and super important. Whenever you notice that you're feeling anxious, it's important to say, okay, what's going through my mind right now? I'm noticing I'm feeling anxious, or I'm noticing I'm feeling body sensations that are related to anxiety for me. Let me check in with what's going through my mind. So you want to examine what thoughts are coming up for you. You may identify what's called limited thinking patterns, where it's these patterns that really kind of limit the other information that we're taking in a situation, where let's say that I'm engaging in the limited thinking pattern of filtering. So if I'm doing what's called filtering, that means I'm really only focusing on the negative aspects of a situation, and I'm not acknowledging or retaining or bringing in the positive aspects or neutral aspects of a situation. So I might notice through doing several thought records that, oh, I tend to really kind of block out the stuff that's not so bad and focus on the stuff that's really upsetting to me, or that brings up anxiety for me. And then you'll also work through a thought record to identify what's called an alternative thought. So is there another way I could think about this? Because we know that the way that we think impacts the way that we feel. So is there another way I could think about this that might also change how I feel about this? And then you got to practice. So you do the work to identify these things, and then you want to put it into practice by when that thought comes up, that you're going to then say, oh, there's that thought. Let me try to remember. You might even have it written out for you, your alternative thought, so it's easy to remember. There's that thought again. I'm going to try to bring in this alternative thought and remember this other way of thinking about it. And then there's also activity scheduling that's part of CBT, where you're making sure that you're doing things that you might avoid. You're not going to throw yourself into something that's super anxiety provoking. Like if you're afraid of spiders, you're not going to schedule an activity to go into, walk into a spider web. You're going to schedule activities that you might typically avoid, like maybe just spending time outside. If you're afraid of spiders, you might make sure that you're doing like a short mindfulness walk or something. So the example here is that if Jane's applying to jobs, let's say that a thought that keeps coming up for her is one that we mentioned a little bit ago, that what's the point of me applying? I'm not going to be the best candidate. There's no way that they're even going to look at my resume, so why even do this? So she might, if she's working with a CBT therapist, she might fill out a thought record on that thought of what's the point? They're not even going to look at my resume. So she might break that down with her therapist, like, okay, if that's the thought, what emotions do come up from that? Well, fear, anxiety, dread, hopelessness. Okay, and what does that thought make you want to do? Well, it makes me want to avoid. It makes me want to not even try. It makes me want to, like, I ruminate about it. I think about it over and over again, and then I kind of spiral, and then I end up just laying in bed all day. Okay, well, if those are the thoughts and the behaviors and the emotions that come up, what are some things that we can try to do instead? What are some other behaviors we could try to do? Well, I could try to fill out one application, maybe even do that sitting, with my family or something. So I'm a little distracted here and there too. Maybe I could plan to do something rewarding after I fill out an application. Okay, great. So what might be a different thought that we could hold on to when that thought, what's the point, comes up? Well, I can remind myself that, I have gotten many accolades and awards and achievements noted on my work at other jobs, and that there's a lot of evidence that I'm actually a really solid candidate. I can remind myself that. And also tell myself it's normal, like it's okay. It's normal to feel anxious about this. And, you know, I do actually have a lot of evidence that I'm a good candidate. Another component of CBT is to practice relaxation. So you'll remember this from exposure therapy. CBT has components of exposure within it, such as activity scheduling. Practicing relaxation is really important as well. So when you're paying attention to anxiety coming up in your body, you're going to want to do the things that help to tend to those sensations so that it doesn't turn into full-blown panic. You might notice that you're feeling shortness of breath or dizziness, increased heart rate, tension in the body, and then you might go toward progressive muscle relaxation to try to calm your body down, or paced breathing. Another intervention is problem solving and successive approximation. So this is, again, similar to exposure therapy. Successive approximation is like moving toward your goal in small steps. You will break down problems into smaller, more achievable steps, so it doesn't feel like such a mountain to climb. If we have a couple things, a couple steps that are really huge, it might make us feel pretty avoidant or fearful of even like, where do I even start? But if we're able to break it down into really small steps, as small as you can get, then you can go through and it feels really good to check things off as you go. And it can help increase your belief that you're capable, so your self-efficacy in those situations. So Jane, preparing for a job interview, she might go back to first practicing relaxation through paced breathing, like doing some really slow counted breaths where she's really trying to pull her breath down into her tummy and hold it, and then exhale slowly, and keep doing that for a little bit until she starts to feel some tension leaving her body. And then if she's doing problem solving around it, she might break down all the steps she needs to do. That, okay, first I need to update my resume. And maybe a step in that is just opening the Word document. It can be as, you know, breaking it down as much as that. And then the next step is that I'm going to update the first half of my resume, and then I'm going to update the second half. And then the next step, I'm going to have somebody look it over. And then the step after that, I'm going to start looking at, my goal will be that I'll look at one job site a day and look at postings, and on from there. So the, excuse me, the last therapeutic approach that we're going to talk about is acceptance and commitment therapy. This is also known as ACT. So ACT is kind of like a third wave of therapeutic approach coming out of traditional behaviorism. So it's taking where we're looking at the behaviors, we're looking at the way we're thinking about it, and now we're weaving in these like nuanced pieces that have been shown to be important in reducing anxiety and increasing the overall quality of life. So we have this group here at Clearview as well. We have, just to kind of go back, we have all of these approaches here at Clearview are part of the groups, part of the treatment. Prolonged exposure is only, again, just to reiterate, it's not something that at the Women's Center we typically do. We can do it here at the Women's Center, but parts of exposure can be kind of implemented in where appropriate to the client's day-to-day treatment. So ACT is a group that we have here, and it's mindfulness based. So there's definitely a lot of overlap with other approaches. It's going to be accepting what is difficult, which means anxiety, and the fact that there are a lot of situations, especially with these different anxiety disorders, where it's not avoidable. Even when we try our hardest, things are going to come up that are going to produce anxiety. So we want to accept the experience we have when that comes up. And also the component that ACT is really weaving in that helps to increase quality of life is connecting with values, character traits, and goals. That's something that they've kind of added and elaborated on the other therapies. And taking action steps that keep you connected to your goals and values. So mindfulness is a really big piece of this. Again, that's practicing acknowledging without judgment. So same as what we talked about in DBT, you're really paying attention to the present moment on purpose and you're accepting it. Doesn't mean you like it, but you're acknowledging that this is what reality is in this moment. Thought diffusion is a really important aspect and intervention or tool in ACT. This is where you take those problematic thoughts and you turn them on their head, so to speak. You kind of take the power out of them, because if we're able to get a little bit of distance from some of these thoughts that are so problematic, we can see them for more of what they are, which is just a string of words that we have put a great amount of meaning in. So there are many, many techniques that help us to defuse from those thoughts. And it's using a lot of imagery, action, ideas to get space from that. So in preparing for an interview, if Jane keeps having the thought that I'm gonna blow it, I'm gonna be so anxious, I won't be able to do anything about it, I'm going to freeze up and not be able to speak, then if she's using thought diffusion, which in that moment she's very, very fused to that thought, she can't even like see or think about anything else in this thought that she's gonna blow it. She might take a breath, notice that's how she's feeling, and then use thought diffusion by saying like, okay, I'm going to imagine this thought going by on a train right now, and I'm just gonna step back and I'm gonna see this thought going by and I'm just gonna notice it. That's one example of thought diffusion. She could also repeat the thought over and over again so quickly that it loses meaning, because if you've ever done that just for fun, you'll notice that it's at some point sounds like gibberish. And so that can be a really, really great tool. And that's another example of thought diffusion of like, if she said, what's the point, 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 like over and over and over again, then she might at some moment in time realize like, oh, that sounds like gibberish. And that'll give her just a little bit of space from that thought to see like, okay, maybe there's some room for problem solving this or thinking differently about this. Values are extremely important in ACT. So what you would do is you would identify values that you want to remain connected with or start connecting with, and then figure out like, what are some things I can do to commit to action and work toward these. Emotion acceptance is also another really big one. We spend so much time, especially, you know, if you're struggling with anxiety, there's a lot of effort put into controlling it when it comes up, trying to get rid of it when it comes up, trying to never have it come up in the first place. And so emotion acceptance is a very big part of ACT. And so instead of suppressing or blocking it, which actually makes things a lot worse, even though in the moment we don't realize it, it feels like we're doing something to help anxiety, it often doesn't. So you want to use imagery, action, or ideas similar to thought diffusion to allow the emotion to be what it is, which is a feeling that is going to change. And most emotions change pretty quickly if we don't hold on to them or like magnify them or push them away. Most emotions on their own don't last very long. So allowing it to pass through and change. So again, example, our gal Jane, she's searching for jobs. She's feeling very anxious the more that she looks at different postings. And so she might notice the anxiety coming up, and using imagery with emotion acceptance, she might imagine that her tummy is full of butterflies right now, and she's going to kind of capture them and put them, or fireflies, let's say, put the fireflies in a jar and make room, imagining there's like a shelf in her tummy that has space for that jar full of fireflies. And so it can seem a little bit abstract for some people. That imagery though is really helpful, and that like, this is an experience you're having and let's make space for it and allow it to be there rather than fighting it or pushing it away. Another emotion acceptance is like healing hand. So you may notice like, I'm feeling really anxious. Let me just put and rest this healing hand here and just notice that and sit for a minute and be mindful of it. So something, that's the wrap on different therapeutic approaches. We wanted to make sure also that there are some resources. There are so many resources for anxiety and depression. Resources if you or a loved one is struggling with self-harm or suicidality. Suicide prevention hotline is listed there. Um, there are a lot of different resources, so I just put a few kind of spanning some different nuances in anxiety. Hopefully some of them are helpful. A lot of stuff online. You guys, I believe, have the PDF of these slides, so you have them there. And let's see here. Yeah, there's some literary resources, online resources, and the suicide hotline. Yeah, I think that's it.